Vice-Chancellor, Pro-Vice-Chancellor, colleagues and friends, graduates and graduands and their families, today the University will award an honorary doctorate to Professor David Haslam, CBE, the current chair of the National Institute for Health and Care Excellence. David was born locally and attended Monckton Combe School in Somerset from 1962 to 67, and the medical school of this university from 1967 to 1972, winning both the Interfaculty Studies Essay Prize and the Pathological Studies Essay Prize. After graduating, he worked in various locations in the Midlands, at Warnford Hospital in Leamington, at North Staffordshire Royal Infirmary, at Birmingham Maternity Hospital, Birmingham Children's Hospital, the Midland Nerve Hospital, Birmingham General Hospital, and as a trainee GP in Stratford-upon-Avon. In 1976, he moved to Ramsey in Cambridgeshire, where he was a general practitioner at Ramsey Health Centre until 2011. Whilst a GP appointment in the flatlands of Cambridgeshire sounds like a pleasant place for a long and perhaps relaxing career, David Haslam's career has been anything but that, and he has served the medical profession both locally and nationally through a wide range of activities. These are simply too many to list in the context of an oration such as this, but notable among them are the patron of the National Association of Parents of Sleepless Children, the Vice President of the GP Writers Association, visiting Professor in Primary Health Care at De Montfort University, at Leicester, Chairman of the Royal College of General Practitioners, Vice Chairman of the Academy of Medical Royal Colleges, President of the Royal College of General Practitioners, National Clinical Advisor, Care Quality Commission, Chair of the NIC Evidence Accreditation Advisory Board, membership of the NHS Information Governance Review, past President of the British Medical Association, and I could continue for several more minutes in the same vein. Working as a GP and holding such a wide range of responsibilities outside that work is, to my mind, quite staggering. Moreover, he has been at the centre of the major changes that the NHS has undergone during the course of his career. Currently, as well as being the current chair of the National Institute for Health and Clinical and Care Excellence, he is also, amongst other appointments, the president of the Ramsey and District Cancer Research Campaign, chair of the NQB Quality Information Committee, and chair of the Scrutiny Group for the Review of Work Capacity. And in addition, and I would suggest quite unlike the majority of GPs, he has a significant written output aimed at both his peers through papers in relevant journals and also to the general public through a number of books with quite intriguing titles: Sleepless Children, Eat It Up, Travelling with Children, Mother Care Guide for the Expectant Father, Stress-Free Parenting, and the Practical Parenting A to Z Guide to Children's Health, many of which have been translated into a wide variety of languages and distributed around the world. I must confess that when I hear some of those titles, I am somewhat cynical. When I read the title Travelling with Children, my first inclination is to say, never, ever do it. Or Stress-Free Parenting, pull the other one. Perhaps on reflection, it might have been good if I'd come across these books somewhat earlier in life and my cynical views might not have developed in the way that they have. But as well as these books, David has also written columns for popular magazines and appeared on a large number of radio and television programmes. He is a Fellow of the Royal College of General Practitioners, the Royal College of Physicians, the Academy of Medical Educators, the Faculty of Public Health, the Royal Society of Medicine, and the Society of Medical Writers. In 2004, he was awarded the CBE for services to healthcare. And if, like me, the simple reading of that list makes you feel weary, there is more to come. It's perhaps difficult to conceive, but David also has interests outside medicine, spanning photography, music, travel, skiing, and watching cricket. He took up running in 2005, ran the London Marathon in 2006, and has subsequently completed 2 other half marathons and numerous 10K events. He is married with 2 adult children. His wife, Barbara, who is with us and who herself was a student at this university, works as a community paediatric physiotherapist, whilst his son is an author and a journalist, and his daughter is a general practitioner. Vice-Chancellor, Pro-Vice-Chancellor, for a life lived to the full in the service of others, both his patients and those in the wider and national community, I present to you and to the university Professor David Haslam, CBE, for the degree of Doctor of the University, honoris causa.
By virtue of my authority as Vice-Chancellor and with great pleasure, I confer upon you the degree of Doctor of the University, honoris causa. David, many congratulations.
Thank you so much.
And thank you for accepting.
Not at all. It's absolutely my honour. Thank you. Vice-Chancellor, Pro-Vice-Chancellor, I feel exhausted listening to that list as well, I must say. It's like listening to your own obituary. I cannot begin to tell you what an honour this is, and it's really quite an emotional time for me as well. I was born on Ward East 1B at the Queen Elizabeth Hospital, not that far from this very room, and I subsequently worked as a student on that ward. My father was a Birmingham graduate, and he initially worked as a general practitioner less than half a mile from where I'm standing now. And Dad died when I was only 14. And my brother also graduated as a doctor from Birmingham, and he died at the age of 38 when I was still a student. So as a family, we have really strong ties with Birmingham and the university. And as you've been told, I even met Barbara, my wife here, when she was a physiotherapy student. And I couldn't have done without her support over the last 40 years. And amongst everything else, the university taught me one of the greatest lessons of my life, one which had a major impact on my career. In our first clinical session with a real patient, a group of 5 of us were taught about a heart valve problem, a condition called mitral stenosis. This is a narrowing of the mitral valve between the atrium and ventricle, and that causes a flow murmur, a noise that you can detect with a stethoscope. So our tutor, first of all, described the sound, then he played us a recording of the sound on a gramophone record, and then he drew it on a blackboard with chalk. You're getting the sense of how long ago this was. And when we all understood exactly what mitral stenosis sounded like, he wheeled in our first ever patient. In turn, we each borrowed his stethoscope and we listened to her heart, to the different noises, to the opening snap, the flow murmur, the distinctive sound. And when we'd done, he asked us if we had any questions, and we said we hadn't, and he offered us the chance to listen again, and we declined. And he checked that we were 100% happy. We were. And he wheeled the patient out of the room. And one final time, he checked we were all really confident that from now on we would be able to diagnose mitral stenosis. We were. At which point he took his stethoscope and unscrewed the end and pulled out a long plug of cotton wool. None of us had heard a thing. We'd all been much, much too embarrassed to say. And he went on. He said, today's lesson wasn't about mitral stenosis. It's about honesty. It's about being able to say when you don't know, about not being embarrassed by looking ignorant. If you don't understand something, ask. It was a fabulous lesson. I think it helped make my career. I've lost count of the times I've asked something after a presentation that I didn't understand, and people come up afterwards and say, I'm so glad you asked that. I didn't get it, but I didn't like to say. And I really commend it to you as a rule for life, along with my one other piece of advice. The saddest 2 words in the English language are, if only. When faced with an opportunity, the test I've always applied is what I call my deathbed test. I imagine myself, rather optimistically, at the age of 99, looking back on my life, and I ask myself, would I have wished I'd tried whatever it is? So faced with an opportunity, a promotion or an election to a role, for instance, well, if you try and fail, that's life. You tried. But if you don't try, you'll never know. And you'll keep wondering, if only. Which is how I ended up doing some of the fascinating roles that I've done. When I graduated from this university, I would never, ever have dreamt that I've had the career I've had. I would have never dreamt that my university would honour me in this way. I have to say I'm astonished and I'm deeply grateful. So to all the new graduates here today, my warmest congratulations. Have a great life, but make sure you go on asking the awkward questions. Thank you.